Welcome to our first webinar, our first Radiant webinar. My name is Abigail. I'm the marketing director of Dr. Corman Laboratories, and we're very excited to have Dr. Marina Landau with us to share her vast experience treating young but also older patients. So thank you, Marina, for being with us. Before I hand over to Marina, I just wanted to mention that you're welcome to send us questions throughout the whole webinar via the chat button that you have in the lower bar, and we will be able to forward it to Dr. Marina Landau, and we will have a designated 10 minutes in the end of the webinar so she can respond to all your questions. So a warm welcome, and I hope you will find it very useful for your practice, but also joyful. Marina.
Thank you very much, Abigail. It's my pleasure to be again on Zoom. So I don't have a slightest idea who is listening, who is watching us. I hope that this activity will enrich your knowledge and your experience. And I'm about to start. So I'm going to share the screen. Let me see. I think this is the right one.
Perhaps we should wait 2 or 3 more minutes because I see that the participant just joining us. So maybe let's take 1 or 2 minutes.
I just say a few words about my experience with dermal fillers. I'm a dermatologist. I'm doing both medical and cosmetic dermatology. I'm based in Israel, the home country of Dr. Corman Laboratories. And my experience with dermal fillers is quite vast. I have experience with using almost any registered dermal filler. And in every point of time, I use more than a single brand. And this is because we have different patients. Our patients have different needs, different areas in the face do require different fillers with different biochemical and physical properties. So when I'm talking about my experience with any kind of filler, it's usually based both on the experience, but also on comparative experience with other fillers. There is a lot of good fillers currently on the market, so I think that every injector has to find what are his favorites. But don't stop in one point. You just keep searching, because the science of dermal fillers is in constant development. I definitely use currently different fillers than I used before. And it also very much depends on who are your patients. Younger patients require different fillers than elder patients. So this is actually what I will try to show you and to teach. It's not teaching, it's sharing my own experience, because again, we're talking about something which is science, but also has a lot of art in it. So each one of us has a different artistic view. And I think this is, the artistic view is one of the most important aspects of our medical profession. So should we start?
Yes, let's start. Thank you.
So the general topic is the facial harmonization of using Radiant family of dermal fillers. And it's more like actually showing what can be achieved in different areas of the face. How do I judge the patient? Because for me, medical consultation is the heart of the relationship with our patients and success of failure determination. Let me see how I move it. Okay. So first of all, what brings our patients in? Why currently dermal fillers are so popular? There are a lot of answers on this question. I will tell you, this is my opinion. I think first of all, people live longer. And this is a graph showing life expectancy in the different areas, starting from 1950 and projected to 2050. So people, is it Corona or not, people will live longer. And because we live longer, we have enough time to age. And if the longevity life expectancy will increase over 100 years of age, this is how most of us will look if we don't interfere with the aging process. And I think that you have the same experiences as I do. We have now more and more elder patients coming to our offices looking for the enhancement of their look. But it's only one aspect, because the other aspect is younger patients. Why do we have so many younger patients currently, patients that maybe 10 years ago, I will kick them out of the office, but in the last years, I do see it and listen to their complaints, because this is what literature is showing. It's not medical literature, it's the Girl Guides Association publication, but it shows results, it's very nice, very interesting actually, a survey in which girls of different ages have been asked how happy they are with the way they look. And if we follow the green line, which shows very happy, so when we go from the age of 7 to the age of 11, a lot of the girls that have been very happy with their looks at the age of 7, suddenly they are not very happy with their looks when they are entering the teenage. And the same, so this is what we have in the two extremes, the elder ones and the younger ones. And this is one of the reasons why patients are coming to ask for enhancement. When we're talking about differences between the genders, this is a publication from a Journal of Clinical Aesthetic Dermatology, and I think, again, it's very important for me just to understand the dynamics of what's going on. If we look at gender motivation, what motivates our patient to come to the offices, to our offices. So career advantage is important both for males and females, but it's more important for males. So if we are currently seeing more and more males coming for minimally invasive procedures, one of the motivations is to succeed more career-wise, but also under peer pressure. You see, peer pressure, it's one of the motivators for males to come to the offices. While for females, for example, it's much less important. Whatever we think about females, most of them come to our offices out of self-motivation, not because somebody else is pushing them. Again, look here. Close family member or partner is a very important motivation factor for male patients. For females, less. So females are getting treated for themselves. Another reason why we have more patients coming, because we have more and better technology. This is quite an old slide from plastic surgery statistics, but if we go, the numbers are only increasing. And again, botulinum toxin and soft tissue fillers are still the leading procedures, the leading technologies. But it's not the only technology that motivates our patient to come to the offices. This is the mobile technology is a very important motivating factor currently, especially now in Corona days. Our patients are coming, and when I ask them what brings you in, I do hear the complaint that at Zoom they are concerned about the sagging of the lower face or the deepening of nasolabial folds. So it's something which we did not consider before as a motivating factor. And currently, you know, we use mobile technology more as cameras than for communication. And we all know what is the best position to get the best photo, but mobile technology is also one of the motivators, especially selfie, because to take a good photo, we need the distance for approximately 2 meters. Then we have full for harmonization of the face without any fillers. When the camera getting closer to the face, especially like 40 to 30 centimeters, which is the average length of the arm, then we have a distortion. This distortion will actually accentuate all the pathology of the center of the face. And if you did ask yourself why we have more patients coming currently for teardrop correction or secondary rhinoplasty or even lips, it's because in selfie these areas are accentuated. So if you have any defect there, it becomes more and more visible. And again, following the same publication, one of the self-reported motivation for seeking cosmetic procedures is to look better on photographs. And we're talking photographs, nobody's talking about the traditional camera. We're talking currently on about mobile technologies. So it seems quite strange, but this is the reality and we have to accept it. So what can be achieved by using minimally invasive procedures? And I do like to look at nice faces and to follow up what is happening with them in time passing. And you see here a photo of Juliana Moore, 13 years difference. We do see that she aged, but she still looks very graceful. So aging is inevitable, we have to accept it, but graceful aging is possible. And for me, this is the target of everything that I do in my office. If you look to Michelle Pfeiffer, and it's 24 years difference, she still looks very attractive and very beautiful. But I do ask you to look at her forehead and look at her forehead wrinkles. So couldn't Michelle Pfeiffer afford herself a little bit of botulinum toxin? Of course she could. But she still looks beautiful in spite of the wrinkles. So for me, it says, so for me, a wrinkle is not necessarily the enemy. And it is important because sometimes we have patients who are coming to our offices again and again to correct a completely meaningless wrinkle. And by filling it up again and again, we actually distort the face, we overfill the patient. And so please try to teach yourself and your patients that the wrinkle is not necessarily the enemy. We have to get used to look at the face at all, like one single unit. And this is something that we do see Olivia Newton-John at her younger age and elder age. And you know what I could tell about her, that she is beautifully injected. Is it a compliment? I'm not sure. So for me, overdoing is our enemy, and we have to go back to look at the patient's photos when we first saw her, to look at the faces when they are relaxed, when they're animating, and ask ourselves whether we are helping or actually distorting the face. As I mentioned before, cosmetic consultation for me is the most important meeting point between me as a physician and the patient. And I always ask a patient what brings her or him in, what bothers her, and it gives me a lot of different data about the patient. For example, if I'm going to treat this patient, I have to be confident that my aesthetic vision is similar to her aesthetic vision. Because if it's completely different, better refer the patient to a different doctor, because she's not going to be happy with anything he will do her because she sees things completely different. And then I do look at the patient and I tell you what I think is going to be a target for correction, what is needed for correction. And if we both see the face in the same way, this is the first step to success. sometimes the patient is complaining about something that we don't see. Always remember, we sit in front of the patient, so we see things a little bit differently. If a physician is not able to spot the complaint of the patient, first of all, the patient, she might be crazy, but before making this diagnosis, you just change your position and stand behind the patient, so you will be able to judge exactly at the same position with the same lighting, and to see whether the perception of the patient is true, or maybe she is imagining. But this is the before making the diagnosis of a mental disturbance, just change the position and look if you can see better what the patient is pointing on. And the diagnosis of the defect is very important, because if the patient has very bad dark circles around the eyes, as you can see here, and you're going to inject her with botulinum toxin or with a filler in this area, you're probably not going to correct the defect. So make the right diagnosis and decide what is needed for this patient. In my opinion, even if it's not available in your office, better refer to patient to somebody who knows how to do the treatment, than to treat her in your office and then have unhappy patient, which means that she's going to come back, she's going to complain, she's going to suck your energy out, she's going to sit in the waiting room. So I think that it's sometimes appropriate, completely appropriate to recommend the patient will go to, for example, I'm a dermatologist, I'm not doing surgical procedures, so if the patient needs a surgical facelift, I will tell her, I'm not doing it, I think that you need to contact the plastic surgeon. I also encourage you to learn how to decode some specific complaints of the patients. For example, if you have a young patient coming to your office and you ask her what brings you in, what bothers you, and she says, I don't know what, but everybody is always asking me why I look so tired. Where the tiredness is actually, usually it's in periorbital area, the teardrop deformity, and if we correct it, we can make a tired looking face completely relaxed. When I consult the patient, I'm trying to find the Achilles heel. Achilles heel, it's a certain area or certain indication by correcting which I will enhance the face in general. I always hear this nice story about patients who are entering the clinic door saying, doctor, I trust you. I have unlimited financial abilities. You can do whatever you find appropriate. I think it's only in some in children's stories, because most of my patients who come to my office, who's coming to my office, even if they are financially very stable, they want to be, they have some limitation, at least in the first contact. So for me, the most important thing is to find the area that if I could correct it, the patient will look much nicer, and then she will remain my patient forever. So you see here two examples, a male and a female patient. So the male patient had been treated in a completely traditional way for nasolabial wrinkles, and you can judge the improvement, while the lady was treated by malar area augmentation. Nothing has been done to nasolabials or to marionette, but you can really appreciate the improvement in her looks. So those patients are happy, and they're my patients for years. But the secret was to find the right area to be treated with not a big amount of the filler, so it's financially reasonable. And as the patient look at the mirror, they like the change. They have compliments from friends and family. So this is how the trust between the patient and the doctor is built. Sometimes finding the Achilles heel is not easy. For example, we have again a male and a female patient, and the question is where to start. Of course, the easiest answer do both the mid-face augmentation and nasolabials, but then it requires a very big amount of products, which make the procedure very expensive. So the Achilles heel is actually to find a single area by correcting which we will enhance the face at all. So how do I do these decisions? So whether it's nasolabial or mid-face. And you know that nasolabials was the first area that I injected 20 years ago as a beginner. And in the last 10 years ago, somebody actually told, listen, you don't treat nasolabials anymore. And it was based on this publication in Pesach and Rorich from Plastic Reconstruction Surgery. It's 2017, it's not the mistake in the year. But this is what has been shown on cadaver. Saline was injected to mid-face, and there was a claim that nasolabial has been corrected. And look at this picture, I asked myself, was it corrected? Or it is only the needle of the syringe which is supporting the nasolabial. You see the volume here in the cheek, it's due to the injection. But nasolabial was not corrected at all. It's just supported by the needle. So this question was also a question that led another publication. And as you can see here, what has been done, patient has been injected to mid-face, and the others measured the depths of the nasolabials. And what they found, that you do not correct nasolabials at all by injecting mid-face. It can enhance the face, but it does not correct nasolabials. So it is a very critical question when you want to inject only a single area, where to start, nasolabials or mid-face. So what I suggest to do is a smile test. It's a very simple test. I give a patient a mirror and I ask her to smile. When we smile, the mid-face get augmented due to the contracted muscles. The nasolabials become deeper. And I ask the patient, which yourself you prefer, at rest or when you smile? If the answer is, I prefer myself as I smile, the answer for me is, I must start with mid-face augmentation. If the answer is, I hate myself smiling, I know that I have to start with nasolabial augmentation. So this is a simple test which actually helps me to point the Achilles heel of the face, whether to start with mid-face augmentation or nasolabial correction. And you see this patient actually has been filled mid-face, not nasolabials. And let's bring up again the first patient. This one has been filled in nasolabials. So both have very nice result, but the approach was completely different. So smile test can help you to decide where to start. Now, few words about lips. Lips are one of the most challenging areas, and I do like to speak about lips because they are so trendy. Saying trendy does not mean that it is something negative. Some trends started and become general fashion. Some trends are here today and they disappear tomorrow. But anything which is generally accepted currently started as a trend. I'm talking, for example, mini maxi, when we were wearing mini dresses and somebody started to wear longer skirts, it looked a little bit strange. But then our brain got a different setup, and all of a sudden the longer skirts became a completely acceptable fashion, and the mini started to look a little bit strange. So the trends are here. Some of them are going to remain, some of them are going to disappear, but no doubt that looking at something which is trend today, our brains are getting to a new threshold, and they become, the trend becomes actually well accepted thing. So this is what's happening with lips. Lips are changing along the history. Currently, fuller lips are considered to be more trendy, more beautiful, more sexy. But lips at the same time are quite challenging, because looking at the upper lip is everything about shape. To build the shape right, to rebuild the shape, the upper lip sometimes is quite challenging. The lower lips is almost exclusively about volume. So to revolumize lower lip, it's much easier than to change the shape of the upper lips. So for beginners, I always suggest go to the lower lip. Female, sorry, female faces are usually not distorted by volumization of the lower lip. It is very easy to distort female face by filling upper lip incorrectly. And as you can see here, the only thing that has been done on this face, it's volumization of the lower lip. I took away all the feminine recognizing features of this face, and yet I hope you can see the feminization that has been produced by only adding a small amount of volume to the lower lip. So don't forget, lower lip, for me, it's much more important than the upper lip, and much, much more easier. Now, this is one of the most challenging cases. This is a relatively young patient, but we do see it in older patients. The elongation of the upper lip. To correct the elongation of the upper lip is possible. Real correction is possible only with surgery, but we can create an illusion of shortening of the upper lip. And the illusion is created by rebuilding the structures. As you can see here, I rebuilt philtrum, filter colons, I rebuilt the cupid bow. I put a little bit volume in the upper lip, and it seems like the upper lip became shorter. If I measure the distance between the nose and the lip, the distance is definitely the same. So we can learn to create some kind of illusions, but again, it's much more challenging, and it requires a little bit of artistic vision. Let me see why it does not play. It does play. Always remember that embryologically, the upper lip consists of 3 different parts. The lower lip consists of 2 different parts. So when we injecting, we never inject it continuously in continuum, like a sausage. And one of the reasons why we have a lot of strange lips all around is because they're sometimes augmented in the sausage way. Lower lip has to be approached at least from 2 different entry points. Upper lip has to be approached from at least three different entry points.